Okay, now let's talk about how do we transport these gases? Okay, so the respiratory gases of oxygen and carbon dioxide are transported chemically bound to molecules in the blood or dissolved in the plasma. So let's talk about oxygen first. So oxygen, over 98% of the oxygen is carried in the blood bound to hemoglobin. You know what hemoglobin is, and the red blood cells producing something called oxyhemoglobin. The remaining 2% is carried dissolved in the plasma. Remember the blood plasma, blood is about 55% plasma. When breathing normal air, alveolar partial oxygen is always higher than that of blood in alveolar capillaries, so oxygen constantly diffuses from the alveoli into the blood. Okay. We just talked about that. Now, each hemoglobin molecule can bind up to 4 oxygen molecules. Normally in the capillaries of the lungs, all oxygen binding sites in the hemoglobin molecules are occupied, 100% saturated. You probably know those pulse ox that you've seen those. You can see the saturation rate. That's measuring 100% saturation is pretty darn good. Most of you will be at 98, 99%, so you can check that. If a patient falls below 90, 92%, I usually don't work with them because you run the risk of them fatiguing, getting dizzy, or falling backwards. So you want to monitor that oxygen rate because the less amount of oxygen, they can fatigue easily and pass out. So oxyhemoglobin bonds are unstable in areas where the concentration of oxygen is low. So oxygen molecules are released in these areas. Hemoglobin in venous blood is still 75% saturated with oxygen. This provides oxygen reserve. Okay, but if I had a patient with 75% O2 saturation, that would be dangerous, and I probably wouldn't get them up. Okay, factors that increase oxygen release from oxyhemoglobin. Okay, increase in blood concentration of carbon dioxide, increase in the acidity of blood, or increase in blood temperature. So those are all factors that increase oxygen release. Okay, so if I don't have enough oxygen, what can cause that? Well, if I have too much carbon dioxide, I'm going to need to release more oxygen. If the pH of my blood decreases or increase in the sense from a pH standpoint, so a pH of 7 or below is acidic, so that's an increase in acidity, well, I'm going to release more oxygen. Or if I have an increase in blood temperature, I'm going to release more oxygen. Deficiency of oxygen reaching the tissue is called hypoxia and has a variety of causes, so that they can turn bluish. So if you look at this, oxyhemoglobin and oxygen transport, remember our alveolar partial oxygen pressure is 140 or 104 millimeters of mercury. And so if that's the case, well, we don't have a lot of oxygen here. We're going to diffuse from high concentration to low concentration. And now we're going to have that in our blood. So as we go towards the left side of the heart, it's going to distribute it to the tissues in the body. As we get further away, the oxygen levels start to go down, 95 millimeters of mercury, and the tissue we're around is 40 millimeters of mercury. Well, if that's the case, then what we need to do is we need to get back to the right side of the heart and back into the alveoli and exchange that gas, and then just keep going over and over and over again. Okay, so basically what we're trying to do with gas transport is obviously bring more oxygen to our tissues and get rid of the carbon dioxide. Okay, now how do we get rid of carbon dioxide? Because that's the key right here. So carbon dioxide diffuses from tissues, right? So we're going to have carbon dioxide in our tissues, cells into the systemic capillaries, because we want to get them in the capillaries, back to the right side of the heart, back to the alveoli, so you can breathe it out as carbon dioxide and water. So if I go, and that's why I told you to talk to your plants, because plants love carbon dioxide and plants love water. Basically, every time you talk to them, you are giving them fuel. Now, how do we get rid of carbon dioxide? Well, 7% dissolves in blood plasma. Okay, so that's easy. 7% dissolves in blood plasma. 23% binds to hemoglobin to form carbamino hemoglobin, which is it's hard to say. And then 70%, which is the most important, is transported in the form of bicarbonate ions. And the reason it's transformed into bicarbonate ions is basically, if you look at this, CO2 enters the blood from the tissue cells. CO2 will react with oxygen, I'm sorry, water, H2O, and then it forms H2CO3, which will be broken down into hydrogen ions and bicarbonate ions. And the reason that we want to break it down into bicarbonate ions and hydrogen is it's easier to transport. Right? Imagine trying to transport a large molecule or versus a small one. So if we can break it down to hydrogen plus bicarbonate ions, it's easier to transport into the capillaries and back. But once we get back to where we want to go, we'll put it together. Right? So glue it back together and then breathe out. And I'll show you this in a little bit. Okay, so bicarbonate ion diffuses out of the red blood cell and enters the blood plasma. The hydrogen ion binds to hemoglobin, which temporarily acts as a buffer. So carbon dioxide is transported in the blood plasma to the lungs, mainly in the form of bicarbonate ions. When the bicarbonate ions reach the lungs, hydrogen ions are released from the hemoglobin, and the reactions proceed in reverse. So then the hydrogen that took a ride with the hemoglobin is going to match up with his buddy bicarbonate, and then they're going to make H2CO3. And what we're going to do is we're going to breathe out carbon dioxide and water. Okay, so carbaminohemoglobin, I always have trouble saying that, I don't know why. Carbaminohemoglobin also releases its carbon dioxide, which diffuses out of the blood into the alveolar air. CO2 is exhaled from the lungs, and CO2 is released easily in the lungs because the partial pressure is higher in the alveoli than the atmosphere. So if I have more here than outside, I'm just going to breathe it out. Okay. In the outside atmospheric air, carbon dioxide levels are 0.3 millimeters of mercury. And inside, we're at 40. Well, obviously, we want that 40 out. So high concentration to low concentration. So the systemic gas exchange, if you look at carbon dioxide here, remember 7% goes in the plasma, so we're done there. 23% is right here, CO2 here, and then the 70% is the one where we go with water, makes H2CO3, and it's broken down into bicarbonate, goes in the plasma. Then the hydrogen ions will take a ride on the hemoglobin and then meet up in the lungs again and then be expelled out. Okay. On Canvas, I have a step-by-step list of all this, just in case you're like, oh, Patel, you talk too fast, which I do, which I'll apologize, but I do have a step-by-step listing on Canvas, so you can reference that. And then in the alveolar exchange, we've got the CO2 that's in the plasma, that's going to go through. Then we've got the CO2 from the hemoglobin, and then we're going to meet up with bicarbonate, hydrogen, and then H2CO3, and then we're going to release the CO2 and the water at the same time. Okay, so oxygen, just kind of a recap. Oxygen 1 to 2% dissolves in plasma. 98 to 99% combines with iron atoms of the hemoglobin molecules. And the substance that we use is called oxyhemoglobin. Okay. Carbon dioxide is transported three ways. 7% dissolves in plasma as carbon dioxide. 23% combines with amino groups of hemoglobin molecules, carbaminohemoglobin. About 70% reacts with water to form carbonic acid. The carbonic acid then dissociates to release hydrogen ions and bicarbonate ions right here. And if you look at that, that is right here, this carbonic acid. Okay. All right.